Looking back, I think I've always been afraid to go to the dentist. I didn't think I was, but I remember going at age 5 and screaming and having the dentist put his hand over my mouth and deciding right then and there that was not a good place to be. One time I went into a dentist and had to have some work done. She gave me a Novocaine, shot of Novocaine, and she hit a nerve. And so it was extremely painful. I jumped out of the chair, left the dentist office, had my mouth numbed for the whole day, but didn't go back. And that was the tooth that I needed work on. I lived with the pain probably 1 or 2 years, and one weekend it became excruciating. And so we were at the grocery store for some reason or another, and it was Sunday night and I was in pain, and who is in the aisle right next door to us but Dr. Carter. He came over to us. It was the strangest thing. And he said, "Well, how are you guys?" And I said, "Aubrey, I'm in terrible pain. I'm not good." And he said, "Come see me." My feelings thinking about going in were total fear. I mean, we had to stop twice on the way to the dentist office so I could go to the bathroom before we could get to the dentist office. And my husband had to take a day off of work to actually walk me in through the door and to make sure that I stayed in the office. So I was just very, very, very fearful. And then going in and being around his receptionist and seeing the kind looks on their face, and then him coming to the door and bringing me in and telling me that it was going to be okay, and holding my hand. He had to sit there and hold my hand. I relaxed, went to sleep, he did the work, I got out of the chair, went home, and I was extremely happy. So that made the next time and the next time easier to go. Call him and he will talk to you on the telephone. And that actually, I mean, being able to talk to him before I went to the office was the first step. So if they could just call and listen to his voice and listen to the reassurance that he provides when you're addressing these fears, that would be the first step. He's an expert, and he will hold your hand through the process. He will sit there and talk to you before he puts it in. He's going to tell you what he's doing. He's going to tell you, quickly how quickly you're going to go under, and that he'll be right there when you wake up, and that you'll feel nothing. And you'll wake up refreshed, which is true. You can get up out of that chair and walk out on your own, which is differently than taking the pill. You can't get up out of the chair. I mean, you need somebody to pull you up and walk you out the door still. He's just the kindest, most gentle, knowledgeable, caring dentist I've ever been around. And so he didn't acknowledge my phobias with disdain and, "Oh my gosh, you can make it through this, come on, buck up." He was just the kindest, most gentle gentleman dentist I've ever been around. So it wasn't just the fact that I was receiving this medication that was going to put me to sleep so I didn't have to feel anything. It was this person who was respectful of my feelings and who was very careful with his needles that made it all possible. Because otherwise I think I would have walked out of the office. If it would have hurt going in, I would have been up out of the chair and gone. He is the most kind and caring dentist I've ever been to.